At Overlake, the structural heart program is made up of 3 different institutions. We have Overlake, we have Evergreen, and we have Kaiser. And since 2014, we have been working together to care for patients with structural heart disease. People often ask the question, what is structural heart disease? What do you guys do? A good way to explain to patients what we do is I use a house analogy. Structural heart disease deals with the structure of the heart, with the anatomy, just like the structure of a house. It doesn't deal with the plumbing, heart vessels. It doesn't deal with the electricity or some of the arrhythmias that we encounter. It's strictly with the anatomy of the heart. We treat patients with aortic stenosis, which is a narrowing of a valve. Patients have their aortic valve slowly narrow over time. Eventually, that pump is going to give out and doesn't work. And without replacing that valve, life can continue. And traditionally, what we used to do is to do cardiac surgery, which is we open up the chest on the heart-lung machine under full anesthesia, and then have to open the space where the aortic valve is and then replace the valve. The vast majority of patients are going to be suitable and appropriately treated with minimally invasive techniques, which is the catheter-based techniques that we refer to as transcatheter aortic valve replacement, or TAVR. What we do with treating aortic valve stenosis is we make little incisions wherever we can get access to it. Typically is through the groins and the femoral artery. And then we insert our catheters, deliver them to the space of the aortic valve, and replace the valve using the catheters. It takes anywhere between 20 to 30 minutes to do. The chest is not open. There isn't any anesthesia or heart-lung machine. Patients come in one day, they go home the next day, they're recovered within a few days.
So there are a lot of benefits to TAVR procedure. So TAVR benefits include less invasive than open heart surgery. Patients typically leave the hospital in one day, maybe 2 if there are any concerns, and patients return to their normal lives faster compared to open heart surgery. As with any procedure, TAVR carries a variety of risks. TAVR's risks include bleeding, infection, abnormal heart rhythms, valve failure, stroke, death, and heart attack. Through our partnership with Evergreen, Overlake, and Kaiser, our extensive experience has able to truly evaluate patients, minimize these risks, and optimize benefits for our patients.
The decisions on key points, these things are all determined at the level of the heart team. The heart team is a much bigger group of people that meets every Wednesday, and we talk about every patient in detail. So each patient that's referred for TAVR is going to meet personally with a cardiac surgeon and an interventional cardiologist. They're also going to have some imaging done, a CAT scan from the neck down to the top of the legs to look at the heart and the blood vessels in the body. The heart team then hears about the patient from the surgeon and the interventional cardiologist within a week, and we talk about all the nuance of the patient, all of the social factors, the physical factors. We look at the imaging in depth, and we make a determination, what is the best therapy for this patient? So a real advantage to TAVR is the hospital process, because patients check in the same day. They get checked into a preoperative area where they meet their nurse and the anesthesiologist, and the cardiac surgeon and myself will come and talk to the patient. We do informed decision-making on that day. We then go to the operating room or the cardiac cath lab, and the procedure is performed. Once in the operating room or the cardiac cath lab, the procedure will last 30 minutes to 1 hour. During the procedure, patients are given conscious sedation, which means they're just made to feel relaxed. They're not put to sleep or intubated, per se, with a breathing machine. After the procedure, they go to our post-operative area where they are attended to by our nursing staff. We review things with them and their family, and they're awake the whole time. They are then admitted to the hospital overnight. The next day, after they work with physical therapy, over 90% of our patients are discharged. Patients should choose Overlake Structural Heart Program because it's been around for over a decade. It brings vast experience and expertise from 3 major medical institutions on the east side. We have a very invested group of coordinators in our clinic, as well as clinicians that care deeply for our patients and guide them through the process. When we look at clinical outcomes after TAVR at the Overlake Medical Center Structural Heart Program, these are leading outcomes in the state and leading outcomes in the nation. We have tracked these very closely for over 10 years, and we are consistently in the top quartile for outcomes when it comes to TAVR.